Hi, welcome to all of the media who are joining. We're just waiting a moment while we go live streaming on Facebook. Welcome to everyone who's joining us. We're waiting a moment as we go live on Facebook, and then we'll start the briefing. Hello and welcome. We're now live on Facebook. My name is Kate Cole with Public Health Seattle and King County, and thanks to everyone for joining us for this press briefing with our health officer, Dr. Jeff Duchin. Dr. Duchin, I'll turn it over to you.
Thanks, Kate, and thank you everyone for joining today. It's good to be with you again on Friday. Since our outbreak was recognized, we've had approximately 78,000 cases, 4,800 hospitalizations, and over 1,200 deaths, approaching 1,300. And this is 37 more deaths than were reported just a week ago when we spoke last Friday. Now, it's very good to report that our new cases continue to fall. They've been falling for several weeks now, and this is something we should all feel very good about. But at the same time, we can't ignore that the level of COVID-19 transmission and the risk here continues to represent a serious health threat. Our 7-day average case numbers are still over 200. This is 3 or 4 times what we saw in late September and 7 times what we saw in June. And our 14-day incidence rate is still considered high risk. Approximately 2 people died from COVID-19 every day last week, but this is down from 8 to 9 a day during late December, and that's very good. Now, it's important that I point out the disparities in COVID-19 impact that persist even as our rates are falling. Case rates in South King County, especially Auburn, Kent, and Federal Way, followed by Burien, Renton, Tukwila, and SeaTac, are approximately 3 times the case rates in Central Seattle. And the hospitalization and death rates are 3 to 4 times higher in those areas. Our decreasing case numbers are great, but that should not be misunderstood as a safe level. Another recent trend is that since the holidays, fewer people have been seeking testing. And I just want to again remind people how important testing is to limit the spread of infection to others. If you have symptoms of COVID-19 or you've had close contact with someone who's ill, please isolate away from others and get a test. You can do that through your provider or at one of our free testing sites in King County. Isolate yourself as soon as you feel sick isolate from others as soon as you feel sick and while you're waiting for the results. I want to give a brief update on the variant strain that has been detected regionally, the B117 that was first recognized in the UK. It's as though we're experiencing 2 outbreaks now. We're currently seeing a decrease in cases in the outbreak that we've been experiencing from a virus we've gotten to know over the past year, while at the same time, a new outbreak threat from the variant strain B117 is growing and largely is silent at the moment. But recent estimates from other countries suggest that the variant is doubling about every week. And when a small number doubles, we don't notice it much or even at all. But once that doubling creates a large number, it gets real big, real fast. And the larger a COVID-19 outbreak gets, the faster it grows. I feel that we're in the eye of a hurricane. And I want to remind everyone that we should expect the variant strain to become widespread here and that it will make our outbreak much harder for us to control. In other countries, this variant has led to new peaks in cases and deaths that were greater than what had been experienced previously. We have an advantage of early warning to help us prepare by getting COVID-19 transmission as low as possible now. And we absolutely must remember that as we increase activities, we increase opportunities for the spread of COVID-19. The variant strains spread from person to person the same way as other strains, primarily through the air, but they're better at it. And that means if you're exposed to someone with COVID-19, you're more likely to catch it, and people with COVID-19 will be more likely to spread it to others more quickly. So for this reason, we need to be more careful and more effective against a stronger virus. The same prevention strategies that we've been using can work against variant strains, decreasing contact with others, especially indoors, masks anytime you're around someone outside your home, and distancing. But we need to be better at them and use them more consistently. The bottom line is these variants represent a game changer. They're faster and more dangerous. Now, speaking about games, I want to say a few words about the Super Bowl. And I want to start by congratulating the Seattle Seahawks for winning the most important competition and being the only team in the NFL without a confirmed COVID-19 infection, as reported by today's New York Times. But for the other Super Bowl, for Sunday's Super Bowl, it's the fans that are at more risk than the players on the field. The NFL figured out how to protect their players and staff, and they took aggressive actions to keep them safe. The NFL found that COVID-19 can spread with even brief interactions indoors, especially in poorly ventilated spaces, and that spread was reduced through increasing mask use, avoiding high-risk activities, such as sharing a vehicle and carpooling together, eating in the same room, and so on. COVID-19 spreads mainly through the air. Again, ventilation is important. So the best Super Bowl advice is please don't gather indoors with non-household members, or everyone risks ending up on the injured list with COVID-19. If you do watch with others indoors, make sure to open windows and increase ventilation and wear masks. Eat outside. Outside is always safer than inside. And remember, just breathing and speaking puts the virus into the air if someone has COVID-19 and doesn't know it. And up to half of all COVID-19 infections spread from people who look and feel ill. Up to half of COVID-19 infections spread from people who look and feel well. They don't know they have COVID-19 and they don't appear to have symptoms. So we need to expect that others around us may be carrying the virus and unintentionally spread it. If ventilation is not good, the virus can build up in the room just like cigarette smoke would. And singing, speaking loudly, and shouting put out even more virus. So please try to limit loud cheering, especially for Tampa Bay. Now I want to pivot and talk about vaccine. Our allocation remains stable at a much lower level than we would like, but we are continuing to vaccinate King County residents as quickly as the vaccine supplies allow. Washington State is only receiving less than a third of what our healthcare providers are requesting, only 107,000 first doses for the entire state this week. And we're seeing an increasing demand for second doses because as we immunize more people with that first dose, 3 to 4 weeks later, that second dose becomes due. So there are relatively fewer first doses available if the allocation stays the same. For this week, King County received just over 43,000 doses, of which about half were first doses. And as of the end of January, we had about 300 providers enrolled in our vaccination program in King County. But this week, only 25% of these providers were able to receive an allocation of doses. So let me tell you a little bit about who's been vaccinated. As of yesterday, we vaccinated close to 300,000. Well, we've administered close to 300,000 doses of vaccine in King County. 232,000, approaching 233,000 people have received a first dose. That's about 13% of our King County population. And 60,000 are fully vaccinated. About 2/3 of our eligible licensed healthcare workers in the 1A phase have received at least one dose. That's 85% of licensed nurses and 87% of physicians. Now, our medical assistants and medical technicians have only been vaccinated approximately 47% of those licensed. A larger percentage of these assistants and technicians and long-term care facility staff, as well as home healthcare workers, are people of color. We have vaccinated almost 40% of residents that are 75 years of age and older with at least one dose of vaccine. And I want to remind you that residents 75 years of age and older are between 200 and 600 times higher risk of death compared with 18 to 29-year-olds. We vaccinated over a third of those 65 to 74 years of age with at least one dose. And this age group is at 90 times higher risk of death than the 19 to 29-year-olds. And this compares to 9% of the 65-year-olds and older population last week. So we went from 9% to about 36%, almost a 300% increase. By race and ethnicity, we're seeing 10% of residents who identify as white among those vaccinated, 8% of those who identify as Asian, 5% of those who identify as Black, and 4% of those who identify as Hispanic. Now that's problematic because, as we all know, the impact of this outbreak has been disproportionately hard in people of color, particularly our Hispanic and Native Hawaiian, American Indian, and Black residents of the county. By geography, among those 65 and older, we see the highest rates of coverage on Vashon Island and in North and Central Seattle. That's at around 36, 37% of those 65 and older in those communities who've received a vaccine. 32% of the 65 and older in Bellevue, Mercer Island, and Issaquah area, but only 24 to 28% in the South King County region. Now, these numbers are partly influenced by the fact that the 1A population of healthcare workers and long-term care facility residents are predominantly white. And we're working hard to ensure that vaccine-eligible residents at high risk and living in those areas with the highest disease burden have fair and equitable access to vaccine, particularly those 75 years and older in South King County who are at such high risk, both because of their age and because of the increased level of COVID-19 in their community. We have a strong focus on vaccine equity. Like other communities of color across the county, people in South King County remain at highest risk for COVID-19 infection, hospitalizations, and deaths. And this is especially true in Auburn, Federal Way, and Southeast Seattle. For that reason, we launched 2 community vaccination sites in Auburn and Kent on February 1st that are serving people in South King County who are either over 75 years of age or 50 and older and unable to live independently in their home care, home healthcare caretakers. Now, these are the populations most at risk from COVID-19. King County residents of 75 and older account for 66% of our COVID deaths, compared to 19% of those in the 65 to 74-year-old age range. And many parts of South King County have death rates that are twice that of Central Seattle. Compared with the people who are identifying as white race, people who identify as Black are 3 times more likely to have a case of COVID-19, 3 times more likely to be hospitalized, and 50% more likely to die. And compared with those who identify as white, those who identify Hispanic are 4 times more likely to have a case of COVID-19, 6 times more likely to be hospitalized, and 3 times more likely to die of COVID-19. Our sites in South King County are booked through February, and we feel gratified to have had good success in reaching our high-risk community members. Of those who have appointments at those sites, 64% are 70 and older. The remainder are 50 and older who can't live independently in their home caretakers. 43% of the vaccinees that are registered identify as Black, Indigenous, or people of color. And that's nearly double the proportion of people age 75 and older in South King County who identify as BIPOC. As more vaccine becomes available, we're eager to expand these efforts to other age ranges and other eligibility criteria. We're doing a lot of outreach at the same time to high-risk communities. A lot of our current efforts are focused on getting home healthcare workers and staff in long-term care facilities vaccinated as they're at high risk and have a large proportion of groups who have been the most impacted, including Pacific Islanders, Latinx, and Black workers. We're also working hard to reach people who have difficulty using online reservation systems. For example, the Area Agency on Aging is working with us and has contacted over 3,000 seniors and assisted in scheduling over 1,000 appointments for community members so far, many of whom have limited English proficiency. We're also partnering with community members, community leaders, which we call community navigators, and they represent 22 language and ethnic groups to help eligible people in their community sign up for appointments. And we're continuing to partner with community-based organizations that serve BIPOC older adults, such as Hmong Association of Washington and Helping Link, which serves the Vietnamese community, to help those eligible register for appointments. We're also developing criteria that we can use to guide allocation of doses to pop-up clinics for prioritization of King County's residents who remain most impacted by COVID-19 when we have sufficient doses available to support that type of pop-up clinic. And we're still very grateful to our partners with regional fire departments for our assistance with mobile teams. There are currently 8 mobile teams vaccinating high-risk populations that might otherwise have difficulty accessing vaccine clinics. These are focusing on adult family homes, and then we hope to expand to homebound seniors and people who are living homeless. And we're anticipating having 10 mobile teams eventually. So with that summary of our epidemiology, the threat of the variant B117 virus and our vaccination program, I'm happy to take your questions.
Thank you, Dr. Duchin. So we'll open it up to questions from the media, and please use the raise your hand function in Zoom if you'd like to ask a question. And when we call on you, please state your name and your media outlet. Before we turn to questions from the media, I just want to clarify one item you mentioned, Dr. Duchin, in talking about our emphasis in South King County. I think you mentioned rates are higher in some parts of that area. And I just want to clarify that's incidence rates are twice as high in some parts of South King County, not death rates, correct?
Well, we both incidence, hospitalization, and death rates all track together. And there are communities in South King County that have higher incidence, higher hospitalization, and higher death when compared with, for example, to Central Seattle.
Excellent, thank you. All right, first up is Jessamine McIntyre. Jessamine, go ahead.
Hi, Dr. Duchin. Thank you so much, as always. I'm with Q13 News. I have 2 questions that are unrelated, so I'll start with one, and if I have time for a second, I will, but I'll yield to other media. With Pierce County on the precipice of moving back, how do you feel about where King County stands when it comes to the metrics? And is there a concern we'll see another spike following Super Bowl Sunday as we did following the holidays?
Yes, thanks for your question. So 2 parts, I guess. One is, we are in a region now with our neighboring counties, Pierce and Snohomish. And, this virus doesn't respect those county borders. The virus is impacting our nation as a whole in a way that is more or less consistent. There is some variability that is primarily a function of how well the community members in those jurisdictions across the country, how seriously they take COVID prevention measures, how seriously their elected leaders take COVID prevention measures. And we've done relatively well here in Washington State compared to the rest of the country. The activity levels in Pierce and Snohomish and King have generally tracked fairly closely. So, as a region, we'll have to see, how that plays out. It takes several weeks to understand whether trends are going to be sustained and how extensively they'll be observed. So I am concerned that I'm concerned about any level of increasing activity in our neighboring counties as well as across the state, in addition to, of course, primarily here in King County. And we're tracking very closely our case rates and our hospitalization rates. And as I said, I do feel a bit like we're in the eye of the hurricane here with decreasing rates and people perhaps feeling a little bit reassured about our ability to manage this outbreak, because there is another outbreak brewing beneath the surface of a virus that is able to move much more quickly, able to cause many more cases and many more deaths, as we've seen in other countries. So we need to be vigilant. We all need to do everything we can to decrease the risk of COVID transmitting as we engage in activities through the current phase, and be prepared to quickly pivot backwards if our region starts to move in the wrong direction.
Thank you.
Did I get to both parts of that question?
I think we're going to come back to Jessamine since we have so many questions from different media.
Okay.
Next up is Nick Popham.
Hey, Dr. Duchin, good to hear from you. Was curious about your thoughts on theaters opening back up in our region. I know there's a few in Seattle that are opening back up, some kind of in the surrounding area. Your thoughts on people going back to the movies right now, especially with this variant circulating? Thank you.
Yes, thanks, Nick. You know, I'm nervous about people coming in contact with one another indoors, period. Whether it's in a theater, whether it's in a restaurant, whether it's at someone's home, whether it's in any workplace where people are gathering, especially if there's poorly ventilated areas, if people are not wearing masks, which is why I'm really calling for people to understand that this outbreak isn't over, that we're not out of the woods, that our risk continues to be high, and that we have an opportunity now to minimize the number of cases, hospitalizations, and deaths that we are inevitably going to see related to the B117 strain once it becomes prevalent. And I ask people to take that into consideration when they make choices about how they spend their time and where they spend their time, understanding that this is an airborne virus, that it can accumulate in indoor spaces, that masks and distancing decrease the risk, but they don't eliminate the risk. So it's really a time when we all need to be cautious as we move forward. But unfortunately, you know, there's no easy solutions in this pandemic, and we have strong, compelling arguments around economic arguments for trying to carefully do more activity, and we have absolutely unequivocal evidence that if we don't do that carefully, we will see more COVID-19 transmission. So we really need to balance those two realities as effectively as possible, and understand that if we see COVID-19 activity increasing, particularly due to the variant strain, we will need again to limit our activities. And if our experience is going to be comparable to what we've seen in other countries, it will be very difficult once the B117 outbreak takes off to control it quickly. And those countries have had to resort to very restrictive lockdowns, which we do not want to have to do here. And so acting early will be critical.
Thank you. Next question is Elizabeth Turnbull.
Hi, Dr. Duchin. Thanks for speaking with us today. Elizabeth Turnbull here with the South Seattle Emerald. I know you already spoke about this a bit, but I was wondering if you could talk a bit more about racial disparities and who's getting vaccinated and just what the cause of this is.
Yeah, well, thank you for the question. It's incredibly important, both the disparities in who've been impacted by COVID-19 and also you know, the issues around equity and access to vaccine. So what I can tell you is that For example, with respect to people who identify as white, you know, our people of color in King County, Black, Native Hawaiian, Pacific Islander, Hispanic, have rates of COVID-19 illness, hospitalization, and death that are higher, significantly higher than people who identify as white. And that can range, you know, as high as 12 times more likely to be hospitalized, 3 to 4 times more likely, or 3 to 5 times more likely to have COVID-19 at all, and 50% more to 5 times more likely to die. And similar disparities are seen across the county when you look at geography. So those communities in South King County that we've been mentioning, Auburn, Federal Way, Southeast Seattle, they have much higher rates of hospitalization, cases, hospitalization, and death. And all this is really beautifully laid out on our maps on our COVID-19 dashboard. You can go to the race and ethnicity dashboard, and you can look at the rates of disease by race and ethnicity, and that will include infections, hospitalizations, and deaths. And then we have a new enhanced vaccine dashboard where you can see across the county the proportion of 65 and 75 year olds and older who've been vaccinated by the neighborhoods they live in. And you can see also links to where the disease rates are highest. So, this is something that is a national tragedy, but it's not something that, any of us are surprised about, because we all know that those communities who have had long-standing disparities and inequities related to structural racism, poor access to healthcare, lack of economic opportunity, poverty, and so on, are at higher risk for a whole host of poor health outcomes. And particularly during health emergencies, those communities typically have disproportionate impacts in adverse health outcomes and deaths. And so what we're trying to do now is, we can't reverse, hundreds of years and decades of inequities, instantaneously, but we can work with communities to acknowledge that fact and to try and address this unfair distribution of poor health outcomes as effectively as we can. And that's, one of the things that we're working very hard on here at Public Health Seattle and King County.
Thank you. Next question is from Allison Grande.
Dr. Duchin, if fewer people are getting tested since the holidays, do we have a false sense that transmission is down? And how will Johnson & Johnson getting the EUA, if that comes through, really help in supply?
Thanks. 2 questions. So fewer people getting tested is worrisome, because, well, for several reasons. As I said, up to half of people, 30 to 50%, can transmit this disease before they have symptoms or know they're ill or appear to be ill. So your friends and coworkers and family members can spread it unintentionally. And then people with mild symptoms, who may not feel worried, may not develop, may not be concerned enough to get tested. But also, even those people who have been exposed to others may not be seeking testing now because they don't feel it's important, or people who do develop symptoms may feel like, they don't want to know the diagnosis. And one of the ways we have to measure that is the positivity rate of the tests that we are doing. Among all the tests that are done, what proportion are positive? And we like to see that number ideally, very low, under 5%, certainly, and really closer to 2% if we could. But we know that in some of our communities, the positivity rates have been high, and they continue to be high, over 5%, over 10% in some areas. And that suggests that there are significant numbers of people who are infected but not being tested. To answer your question, that number has not been going up significantly. So it's not as though we're seeing more people who aren't getting tested now. The proportion, I think, is probably too high, but relatively stable. And because of our declining case numbers with respect to the peak after the holidays, it's true that fewer people have the disease as well as fewer people getting tested. So I do encourage everyone to get tested. I do feel like more testing will allow us to identify cases and outbreaks sooner. It will prevent people from spreading the infection to their loved ones, their contacts at home, their coworkers, and their social contacts. So please do get tested. Thank you for allowing me to talk about that again for a minute. Oh, the Johnson & Johnson, yeah. So there are a couple of vaccines on the horizon. Good news, we have 2 more vaccines that are very effective that are in the process of having their data submitted to the FDA. The Johnson & Johnson, or Janssen vaccine, as it's called, is going to be evaluated. Well, they've announced they're going to submit, I think today, to the FDA. And the FDA, this is thousands and thousands of pages of data on their large-scale phase 3 clinical trials that establish how effective the vaccine is and how safe it is. And it will take the FDA a number of weeks to review all that data very carefully, because we do not want to rush approval of any vaccines. We want them all to be considered as carefully and thoroughly and as thoughtfully as any vaccine that ever gets approved or authorized. And so I believe the 3rd week of February, the FDA has called a meeting to publicly review their findings from the review of Johnson & Johnson's submission. And if things go as planned, that then will perhaps lead to an authorization and then a review by the CDC's Advisory Committee on Immunization Practices. So it's theoretically possible that in early March or very late in February, that vaccine might be authorized and recommendations might be available for the use of another vaccine. And this one is quite attractive because currently it's a 1-dose vaccine, although they are looking to see if a 2nd dose would improve the duration and quality of the protection. And that vaccine is much less finicky than the currently available mRNA vaccines with respect to storage. So it can be stored for longer periods and at lower temperatures that are easier for vaccinators to manage in regular refrigerators and room temperature. What we don't know for sure is if that vaccine is approved, how many doses might become available and the timeline. What I have heard was that there would be a relatively robust supply by summer. So more details to come, but it's very encouraging that additional effective vaccines are on the horizon.
Thank you. Next question is from Deborah Wong.
Hi, Dr. Duchin. I'm from KUOW. I'm sure you've heard people's frustrations about how hard it is to get a vaccine appointment and the fact that you have to go to multiple websites and keep clicking through perhaps multiple times a day. And I wonder, I know this is not necessarily the system that you set up, but what do you say to those folks? And I guess the other question is, isn't there a better way? I mean, couldn't we have some sort of centralized system where people could just sign up for a waiting list and then be informed so that they don't have to sit on their computer for hours a day trying to find those elusive appointments?
Mm-hmm. Yeah, I have heard. And I think most of us have heard the frustration. And what I say is I'm very sorry. And I wish we had a better system in place. And we're working hard to put a better system in place. What we're doing here currently is trying to assist particularly those really high risk people right now, who I mentioned, who are several hundredfold higher risk of dying, and particularly from communities that are disadvantaged, who might not have access to the internet or be very facile in speaking English. We're trying to work with community navigators and other agencies and community-based organizations to facilitate helping people find appointments. But overall, for the general population, we also need a better system, because as time goes on, more and more people will be eligible and will have, I hope, more vaccine as quickly as possible. And we're going to need to have an organized system for people to know how to get vaccinated. And I know Washington State Department of Health is working on improving that system. That you are absolutely right, that theoretically there could be a system. However, my understanding is that, each vaccinator uses a different appointment system software and has different medical records. And so when you think of it, just in King County with 300 vaccinators, and then statewide, getting people connected with a vaccinator near them is quite complicated. It's just a very highly complicated technical challenge that I hope we can overcome. And I know we can improve upon, and that is a work in progress. We hear it loud and clear, and it's incredibly frustrating for me to hear those stories. And I know it's even more frustrating for the people who are trying to get vaccinated. I think one thing that's really important for everybody to understand, though, is regardless of how cumbersome, the appointment systems are currently, we are all faced with the fundamental problem of just not enough vaccine. And if we're only, getting enough doses for, a third of those healthcare providers who want them, or a third or fewer of people who are eligible for a first dose every week, even with the best systems possible, we're not going to be able to serve everybody who's eligible right away. And so that's something, all of us are very upset about, and none of us really can do anything about. We are really all dependent on how fast doses can be manufactured and distributed. And the quicker that happens, the better we'll be able to get access, and the more easily people will be able to find it in the community. And we very much look forward to that time, but it's not going to be in the near future. People just have to understand, unfortunately, that this is a months-long process to get vaccine out to all who will ultimately be eligible.
Thank you. Next question is from Pablo Gaviria.
Thank you for taking the time for this. In what percentage of vaccinated individuals have you kept track of data on race or ethnicity? And why don't we record this information every time we vaccinate someone?
Thank you. Incredibly important question. Pablo, really, thanks for bringing this up. So in Washington State, it is required, if you are a vaccine provider, to record race and ethnicity. We do have the data. Take a look at our dashboard. Unfortunately, well, I don't know if I say unfortunately, but it is self-reported race and ethnicity. People have a choice about whether they want to respond and how they respond to that. So we do have data, and we have data from those self-reported, race and ethnicity categories that that people provide when they get vaccinated. We certainly, understand that there may be instances where vaccinators don't record that information, and that's a problem, and we provide that feedback. And we're also working to look at other sources of information that we can use to fill in those gaps when we don't get complete race and ethnicity data, whether we can look at other databases that that data are already in and completed. And because it's critical for us, it's absolutely essential that we have good, reliable data on race and ethnicity, as well as on where people live, to understand how this outbreak, to understand both how this outbreak is impacting different people from different communities, both racial, ethnic, and geographic across the county and the state, but also whether we're getting equitable vaccine access in those same communities. We really want to make sure that the people who are having the highest rates of bad outcomes are having just as much opportunity to be vaccinated as anyone else.
Thank you. Last question we'll take is from community via Facebook. Folks are wondering at what point people who are incarcerated will be receiving vaccine.
Yes, thank you. So incarcerated are part of a category of congregate settings where people, live together and at high risk. They are in the 1B categorization, although I don't have the list in front of me now. If you look at the Washington State Department of Department of Health website, you'll see the current 1A and 1B. Within 1B, there's 4 levels, and we're in 1B1 currently. There are essential workers and people living in congregate settings who are in other phases of 1B, 1B2, 3, and 4. And you can find in there where both congregate settings and other essential or frontline workers will be, at least currently, in the plan to offer vaccine when it becomes available.
Thank you. And I think that wraps up our time for questions. Dr. Duchin, did you want to close out with any final remarks?
I just want to say again, thank you for your participation in these Friday sessions. I really do look forward to taking your questions and having an opportunity to share information. And I again, just want to encourage our community to stay safe, to understand that, again, going back to the football sort of theme for this weekend, at best we're at halftime and things seem quiet while we're in the locker room, but when we come out, the team that we're facing is going to be a lot tougher than the team we faced in the first half of this outbreak. And so we really need to do everything possible to up our game and think about the risk of how COVID-19 spreads and the risk in every context of our lives, and what we can do to decrease that risk going forward. That will keep more of our family members and our community members healthy, out of the hospital, and alive as we navigate through what I hope will be the final months of severe impact from this pandemic. If our vaccine programs are successful, and by next fall, hopefully we'll have made a big dent in the ability of this disease to wreak havoc. But it's going to take an all-out effort from everyone. So thank you for that in advance.
Thank you, Dr. Duchin. Thank you to all the media and folks at home watching on Facebook who joined us today. As a reminder, you can follow along on Instagram, Twitter, and Facebook at KCPubHealth, and on our blog, publichealthinsider.com. Thanks so much.